So very recently I had this conversation with my friend, how she was saying that the healthcare sector has become so expensive. Then while talking, then she came into the fact that vaccines are also very expensive. Then I said, vaccines are not expensive. I mean, being a community medicine physician, I had to defend myself saying that vaccines are given free of cost by Government of India. And then she was astonished, but she was not from health sector. That's why she was very astonished to know that Government of India is providing vaccines for free of cost. Then I made it very clear to her that Government of India is providing certain vaccines and private sectors are also providing vaccines. But what Government of India is providing, that is all those vaccines for those diseases which are of public health importance, which means that those diseases which are of high burden in the country. But private sector are also covering which are important, but also those vaccines which are not so important. But if we see the price difference, Government of India is providing free of cost, but private sector is providing each session vaccination for a child is approximately around some 2 to 3 vaccines. So in per session, you have to pay around 5,000 to 10,000 rupees per session of vaccination. That is a very big amount. So also what she was saying that the health sector is expensive is justified if people don't have enough information. So here I am trying to help how these are different from each other. So one is the cost issue. Another is the two schedules of Government of India and the private sector are different. The Government of India follows the National Immunization Schedule and the private sector follows the Indian Association of Pediatrics Schedule. So both of them are different and their sequence of giving vaccinations are also a little bit different. Coming to the most common question asked by all the parents, like what is painless vaccine, what is painful vaccine? See, vaccine is a needle getting inserted into the child, means during administration pain will be there. But painless and painful is on the basis of the component of the vaccine, which is popularly for the pertussis component in a vaccine. The whole cell component of pertussis is actually more painful in the sense that after vaccination, the pain will be more for the child. There will be, might be redness, swelling and some fever. Whereas the painless will be having an acellular component of pertussis, and in that vaccine, the pain, redness and swelling will be milder, but it's not like that it will not be there. So it's not like pain free, it will be painless in comparison to that. But if you see the price is very, very high for the acellular component of pertussis, whereas the whole cell pertussis is given free of cost by Government of India. Vaccines are manufactured by various brands. So it is important that you stick to the same brand over the period because it will boost the immunity accordingly. That is why it's important that not to keep switching between different vaccines brands and also not to keep switching between government facility, then private facility, then again a government facility. That will create confusion for you, first of all, then there are costing issues and then there will be efficacy issues. So now the question is where you can get those government vaccines. It can be given in any government health facility. For example, from the lowest if we start, it's like Anganwadi, then there is sub-health centers, then there is PHCs, that is primary health center, then community health centers, district hospitals, sub-district hospitals, even medical colleges to tertiary level institutions like AIIMS, etc. So, final summary is that vaccines can be taken from Government of India schedule or from private sector, but the Government of India will provide you vaccines free of cost. If you want some special vaccines which are in the private sector, that can be taken in certain special institutions like tertiary care hospital, etc. It's important to know that there is nothing as painless or painful vaccine in view of vaccine administration. It's related to the component of the vaccine. It's important that you stick to any one schedule, either Government of India or private sector. Don't mix and match, it is going to be confusing for you, plus the efficacy will be in question. Always look for the same brand that is being given, especially in private sector. Thank you.